Now, another big treatment protocol that we have is very unique here is glutathione treatment. Now, glutathione is your body's most intense, powerful antioxidant, and it's produced at a certain level. But if your body is overloaded with toxins and inflammation and free radicals, it becomes overburdened and your body loses its ability. So if you have toxic liver or what have you. So supplementing glutathione is critical for cellular regeneration, stopping oxidative phosphorylation and free radical damage, and in particular, healing nervous tissue. So what we do is we use 3 delivery methods of glutathione. We do it via nebulizer. Now, you can take capsules of glutathione, but they are broken down in the stomach and they won't be absorbed in the body. So we use a nebulizer. We actually have steam inhalation of the glutathione. We also have a cream that we put directly on the affected extremity and heavy massage in, and it's absorbed transdermally. And we also have a suppository option, which is highly absorbable and is also an option for people who have lung problems. But glutathione treatment is one of the cornerstone treatments for nerve tissue damage, and we have an excellent delivery system for that. Now, another treatment modality is oxygenation. Now, we use oxygen concentrators to increase your saturation of oxygen. So if you have decreased hematocrit hemoglobin, you have a problem with your tissue saturation, we will monitor that and give you concentrated oxygen to increase oxygenation to the cells there. So our metabolic approach is to do complete blood work, analyze dysfunctions, recommend nutrients and lifestyle changes, and supplement with oxygen and glutathione. That's our metabolic approach. Now, our neurological and mechanical approach is to look at the lower spine to see if there's degenerative disc disease, spinal stenosis, bulging and herniated discs, and what have you. And one of the most effective ways to combat that is decompression therapy. Now, decompression is a way to treat the lower discs to improve circulation, improve hydration, and decrease bulged and herniated discs. But what we found is when we're decompressing somebody and we put them on oxygen therapy simultaneously, the circulation in the spine is so improved during that time that we can actually kind of nourish the lower spinal cord and nerve system while we're decompressing it to increase oxygenation and glucose flow. So decompression therapy is one of the cornerstones of our approach. But while you're on decompression and you're breathing oxygen simultaneously, we also have you on a vibration device for the feet. And vibration is great stimulation for the lower nervous system. So you're getting decompression, oxygen, and vibration simultaneously. It's a very effective way of increasing stimulation and nutrition to the nerves in the spinal cord. Another great method is laser light therapy. Now we have 2 delivery modes. We have a pad and a probe, which we will use on your lower spine to treat the source at the spinal cord level, but we also have a special boot or an anodyne therapy that is a light that is surrounding the lower extremity that we have you wear there as well. And we use the light therapy, laser, and oxygen decompression. In addition, we also do corrective chiropractic care for misalignments of the spine, and we do neurological rehabilitation. So what we'll do is examine you, we'll find that you have a neurological deficit of one or other side of the body, and we will do neurological brain-based rehabilitation as well. Now, another key component to our protocol is nerve mobilization. Now, nerve mobilization is just as it sounds. The nerve comes out the lower back and down into the legs, and it crosses through a lot of fascia, a lot of tissue, a lot of muscle, and it can get caught in old injuries like a hamstring pull or a bruise or a broken leg or shin splints or what have you. And what we'll do is test you for these adverse neural tension points. And we have a specially trained massage therapist who will spend enough time as necessary in repeated sessions to actually mobilize the nervous system, whether it be with cross-frictional massage, specialized stretching, and we will actually flush the nerve and stretch it and free it up into its adhesions. And so now the nerve is gliding, it is relaxed, and there's slack in it. It will improve the circulation and it will improve the nourishment in there. Right. So on a typical visit, what we would do is first examine our patients. So the exam would include reviewing all recent blood work or sending out for a complete blood panel. We would check for anemias, we would check for blood sugar disorders, we would check for digestive disorders, we would check for your hemoglobin, hematocrit scores, and we would check your tissue saturation of oxygen and your tissue perfusion. So what we do is see how much capacity you have to carry oxygen and how good the delivery system is. And what a good delivery system is a 3.5 to 4.0 perfusion and a 98 to 100% saturation. Frequently, our peripheral neuropathy patients have perfusion scores less than 1, and that's very poor circulation. And their saturations are 96, 94, 92, and so forth. And this is frequently, unfortunately, caused, like I said, by anemias caused by lack of acidity in the stomach, caused by antacids, high blood pressure medication, and unfortunately, statin drugs. Now, I advise you not to go off these medications without consulting your doctors, or more importantly, not understanding why the medication needs are there and addressing them before you lower those medications. So our protocol works slowly over time to wean off of medication. It should never be done by yourself suddenly without the supervision of your physician. All right? So I just want to make that clear. But after we examine you, we also do a neurological exam where we will have a scoring system developed in Toronto that will grade all the peripheral nervous tissues sensibilities: cold, prick, warm, touch, vibration, and so forth. And a perfect score is 76, so we'll grade you against that score, and we'll be able to monitor that on successive examinations to see how your neuropathy is improving. So after we do the initial blood work, we'll also do the mechanical exam. We'll review your MRIs, we'll take x-rays, we'll do a neurological, mechanical, and metabolic review of your systems, and come up with a protocol and recommendation for care. But if we accept you as a patient for care and you're a good candidate for the program, we will first go over the nutritional recommendations to manage your case on the home front, both including nutritional supplements and diet changes. We will then recommend glutathione therapy to do at home. And then here in the office, our typical protocol would be for a patient to come in, lay down on a chiropractic bench, and will receive a chiropractic adjustment to realign the spine, decrease muscle tension, and neurologically balance the cerebellum. After that session of a few minutes, you will be then sent over to receive decompression therapy. Now, decompression lasts about 10 to 12 minutes. While you're being pulled and relaxed, you'll be breathing concentrated oxygen and receiving vibration. After that session, you will then lay on a laser pad for the lumbar spine and also receive some additional vibration for 10 minutes. And then you will receive the anodyne or the boot laser therapy directly on the feet to circulate and re-stimulate the nerve growth in those areas. While you're receiving the anodyne or the boot therapy, you also will be receiving concentrated oxygen in addition. So our program is very comprehensive, both here in the office and at home. And if you're a good candidate and you are interested in learning more about this, please call the number on this website, and we'll be happy to discuss it with you further if you'd like to get examined. Thank you very much.